in trouble in this state.
The Dan Yorke State of Mind program is brought to you in part by Lookout Rhode Island and Taco Comfort Solutions.
And I'm not talking about discipline, I'm talking about needs. We have a freshman state representative tonight from Rhode Island who is going to talk to us about what he sees as the urgent problem. And my guess is he's going to get some results on his argument and the general consensus that early intervention ain't being viewed so early, right? So we'll get to that momentarily. Great to have you aboard. Thanks very much for tuning into this weekend's State of Mind. And of course, our state of mind is constantly in and out, depending on the roller coaster on COVID. Here's the headline that was grabbing us earlier in the week when we found out that, oh my gosh, there's one in San Francisco. Now we know there's one in Minnesota at the taping of this show, which occurs midday on Thursday. Dr. Fauci had this to say about the need for a booster.
We may not need a variant-specific boost. We're preparing for the possibility that we need a variant-specific boost. But the mistake people would make is to say, let me wait and see if we get one. If you're eligible for boosting, get boosted right now.
As a matter of fact, as we speak, I've been shopping for mine. I will tell you that I find this to be very interesting in this sense. As we cruise past our vaccinated 6-month period of time, we have to go out and shop for boosters. But there's a very smaller percentage of people who are doing that. The Omicron thing reportedly has jacked up the pace, and so there's that. But somewhere along the line, it seems to me that we may have to start talking about fully vaccinated, meaning 3 shots. And there seems to be significant hesitancy to even get into that conversation from Fauci, the CDC, the White House, the governors, all that kind of a thing. But it seems to me that at some point it's going to make sense. And those who have conceded to the idea that vaccination is the right thing to do, I think would find it a more clear definition. So stay tuned for that. In the meantime, on things like COVID and test to stay, this headline from Wednesday's briefing, the governor here in Rhode Island is finally picking up the pace on a program that's really necessary. Let's listen.
There's a lot of...
Governor Dan McKee says the Test to Stay pilot program recently implemented in Westerly has saved hundreds of school days.
They were able to save about 315 school days.
With parental approval, the program allowed unvaccinated elementary school students who may have been in contact with someone who tested for COVID-19 to be tested daily for the virus, but still go to class. The governor says the program will now be open to any school district in the state that's interested.
Our parents and staff were surveyed on this down in Westerly, and I believe there was about a very high percentage. I think it was like 97% of the families and the parents really thought it was a great asset.
We also learned today the state is soon to be launching an app where Rhode Islanders can put their proof of vaccination as well as test results. While the health department calls it a health smart card, I asked Governor McKee if it would be fair to call it a vaccine passport.
You can call it what you want. It's an app, it's an application that people can use, they're going to be able to access, and once it's accessible, we're going to make sure that everybody understands how to do it, and then if the people choose to do it, choose to have it there for their convenience in their own lives, then it will be available to them.
First, Test and Stay is late, and we got to pick up the pace. And school districts throughout Rhode Island need to get on board with this. The program is different than in Massachusetts by days, meaning days for swabs and the central funding that Governor Baker put into the mix. But for the most part, it is going to save school hours. As far as the app, look at this from Senator De La Cruz, Republican. Rhode Island was fiercely independent, the first declaration, blah, 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 blah. And he's charging that the governor is implementing vaccine passports. Now, he was kind of casual with that answer, but the bottom line is it's a convenience. And we've got to stop. We've got to stop with this overreaction and divisive politics. Just stop. In the meantime, this headline, protests, homelessness. Senator Mendez Listen in.
I'm going to stay until we are sure that this homelessness crisis is resolved. My message is that the time is up. That they've shown us who they are, and now we're going to show them who we are. Because we care. And there's no one that should freeze to death this winter. And they're sitting on $1 billion and the authority to do something, and they're sitting on their hands.
The governor actually mentioned that he's got a bunch of homeless money coming out of COVID money to be able to respond to this. Her problem seems to be with the legislature that's not coming in to address this moment, but they're coming in January. The governor's got his program. And so she very well may be out there until January, sleeping on the esplanade of the State House, because they're doing the work. And the commitment is to save homeless people from freezing on the streets. It's in place. And one just has to wonder, is the senator who is running as lieutenant governor partner to Matt Brown for the Democratic nomination, whether or not she's posturing for national support for politics, or whether she really wants to problem solve here. By the way, she hasn't mentioned on what particular metric she will fold up her tent. Headline. Yeah, this is concerning. At-risk children in the hospitals and a workforce crisis and a whole bunch of things going on here. Representative Potter is here to talk to us about this. We'll spend a couple of minutes with an executive summary and then we'll kind of dig into it. Welcome. Thank you for joining me.
Thank you for having me, Dan.
That headline is concerning.
Very concerning.
You've been raising the issue. You put out a press release this week. It caught our attention. Give me your bullet points and then we'll dig in a little bit.
Well, I think what we're seeing is a long-term systemic underfunding of our health and human services sector. The workforce there, the wages that people that do this work do not reflect the value of what they contribute. And we're now seeing the culmination of a very, very long process of underfunding that, and it's materialized in a really, really horrific way, where we see children that have developmental disabilities not being able to get the services that they need at a very early age.
All right, that's a good, quick summary. So when we come back, we'll give you a little bit more information on on this particular situation, and we'll talk about what the market issues are. Stay with us. A little bit of background on the conversation.
The situation has deteriorated so quickly in Rhode Island that the state is currently getting fined $1,000 a day because of the improper placement of children under state care. On November 17th, the child advocate for Rhode Island addressed the House Oversight Committee about what she's seeing at the state's Department of Children, Youth, and Families. She warned what staff shortages at the state's social service programs will mean.
Someone's going to sue DCYF. It could be the ACLU. It could be me. We are not serving the children in the way we should, by law or by moral code.
Target 12 has learned the state's social service network has been stretched to its breaking point. One area of particular concern is early intervention, a federal program for kids from birth to 3 years old who have developmental delays.
We are in danger of collapse. I can't emphasize that enough.
John Kelly is the president of Meeting Street, one of the state's 9 early intervention providers.
We have been unable to take on new children since the end of September. We know there's 200 children and families that we haven't been able to take on so far.
The reason? Kelly told the House Oversight Committee that Meeting Street has been unable to recruit or retain staff, leaving him short 9 staff members.
The work is tough, and the pay is not what it should be.
DCYF did not respond to a request for comment. The state is being fined $1,000 a day for improper placement of minors at Hasbro Children's Hospital. With the Target 12 investigators, I'm Tolly Taylor, 12 News.
Talk to me about that.
Where to begin? I mean, it is across the entire health and human services sector. We see it in DCYF, we see it with early intervention, it's everywhere. It's part of the broader economic shift that we've seen through COVID, right, where people have left these positions and gone into higher paying positions, and we haven't been able to recruit and retain people to fill the positions. And again, the culmination is that we have the most vulnerable people in our state that need access to services right now and are being put on a wait list, and it's unconscionable.
What brings your attention to this?
from talking to the advocates, from talking to the people that are affected by it.
What are they saying?
That it's a crisis. And I know that anytime that we have 1.1 billion available, everyone is going to make their point for why their issue is the most important, why money should be delegated to them. But in a situation where we have, again, children with developmental disabilities who have a very limited window of time to get those services, and they're being told that we just do not have anybody to help you, and they're being put on a wait list, it's unconscionable. All
right, so there's a couple of different issues here. Talk to me about the market issue, and that is, you know, the other day, I think you might have mentioned this in another forum too. The other day I drove by, I think it was Chick-fil-A. Starting pay, $16 an hour.
Yeah.
And it just, you say to yourself, wait a second, how is that affecting every other economic industry, or the economics of every other industry? And I actually was on the radio that day and I said, weekdays 3 to 6, by the way, but I just said, I don't even want to make a speech on this. Tell me what $16 an hour at Chick-fil-A means. By the way, Chick-fil-A has terrific employees and an incredible customer service disposition, so good for them. But the responses were very interesting. Our economy is weird right now. Companies who can shift quickly can take your $14 an hour, $17 an hour like that. Government that moves like the Titanic has a whole different approach to this kind of stuff, you know, right?
Spot on, spot on. And I mean, these are large corporations that have the ability to shift those wages and attract workers right now to fill their labor shortage. And there's no guarantee that that is going to be their sustainable metric, right? Same thing, I drive by Taco Bell on Reservoir Avenue in Cranston, big advertisement up, starting pay $17 an hour, right? I don't imagine that that is going to be a sustainable wage that they pay Taco Bell employees a year or 2 years or 3 years from now. But it's reflective of a broader shift of low-wage jobs, which a lot of the people that work with people that have developmental disabilities get paid, and they're leaving these positions to find higher paid positions, and there's no backfill of new employees to be put in there.
Well, yeah, that's an interesting suggestion that they're going to actually drop their employment rates. I'm not sure that you can put that genie back in the bottle, which is why, you know, the economy is going to go through some interesting tumult here over the next year or two. Regardless of whether they do or they don't, you're looking for an adjustment in the social service area. And how do you see that manifesting itself? The government takes money to subsidize employers, mostly private nonprofits.
Yes.
Mostly?
Yes.
For what period of time and on what level of sustenance?
Well, I think that's where the General Assembly comes into play, right? This has to be a long-term, sustainable solution, and it has to be properly funded. And we need to make sure that whatever solution we come up with is not something where we're back to the drawing board a year or 2 years from now where we don't have the funding available for it. In the immediate, what I think would be appropriate would be to delegate some of the CARES money that's still available to backfill some of this, to give, you know, an initial down payment and show some good faith to the people that are working in that field that we are taking it seriously, and we want to preserve the remaining workforce that's there right now so we don't magnify the issue and create a bigger wait list for these children than we already have.
But have you thought through what the mechanics of this are? How do you backfill, and how do you mandate for organizations to increase their pay rates? Do you legislate the structure of pay rates? And all of a sudden you're suggesting that these social service workers end up making a minimum of $20 an hour? Do you set the standards for the economics of that? That would be, That's a tough place and an unprecedented place for government to go, isn't it?
I say it's a much tougher place for government to go to have children that are not getting services that they need. Yeah, I think that's exactly what we need to do. I think we need to raise the Medicaid reimbursement rate for how we pay for these services. I think we need to take it seriously. I think we need to recognize the economic value of funding these positions and letting these people earn a living wage.
So you mandate to the organizations that they must pay X.
And we fund it.
We'll talk more about this because it's not as easy as one would think. We'll be right back. The Division of Truth, how about that for a tongue twister? Children, Youth, and Families, which is kind of at the core of some of the concerns that Representative Potter has here. Okay, I'd have to do some research to see, maybe you've done the research to see where and how, well, we have regulated pay rates before, right? For, help me, for childcare?
There's a consent decree that mandated that people that do the work with developmentally disabled people, direct service professionals, are mandated a certain rate. That does not apply to people that are doing early intervention work specifically. Now, granted, a lot of the people that are really hands-on with that work are clinicians and are being paid a higher rate. But this is part of an overall system that is not funding these services generally to the degree that's necessary.
Is this something that Rhode Island has as a specific problem exclusively, or have you looked at some of the comps?
I've heard that these issues exist in other states too.
So it's a national conversation?
I don't know if it's so much of a national conversation as much as it might be regional.
Well, you know, clearly there's a gap. And what I find interesting is the level of sophistication that's needed for this kind of work, right? And the kind of training that is necessary for this kind of work. You get the special people who have an affinity for kids, who want to problem solve, who have in their heads and in their hearts a real need to improve society, yada, yada, yada. And they get into these fields and they find that they can't chase the bills at the end of the month.
That's it. I don't think anybody goes into this line of work to get rich, but they need to be paid a wage where they can sustain their livelihood. I mean, if you're somebody who has a clinical background and you have a master's degree to be able to do this work and you're still not able to facilitate it and get by, I mean, you can understand why people would leave that field and go find higher wage jobs.
What are you proposing specifically in terms of money? Do you know?
You know, I think we're still in the conversation part of that. I know the governor's budget proposal has $5.5 million initially allocated to early intervention specifically. I think we need to take a look at what the overall Medicaid reimbursement rate being risen will look like for a fiscal impact, but it has to be a priority.
Right. Talk to me about coming back. Do you want to come back early?
I think there's merit to us coming back early. I am one of the legislators who was in favor of us going back early. Although I do think that the issues that we're talking about right now can be handled in the immediate time over the next 4 or 5 weeks without needing General Assembly action right now.
Specifically how? You want the governor to issue an executive order?
I think the governor has the discretion at his availability to allocate some of the remaining CARES Act money.
Well, it's one thing to allocate the money. It's another thing to deal with all the structure that you're talking about.
Right, right. And I think it's going to be a long project. I don't think that it's going to be something that we get back in there in 1 week or one session necessarily and immediately fix. This is going to be something that we have to have a really sustainable, comprehensive, long-term plan for to make sure that we're never in this position ever again.
But what is the initial put of CARES Act money or the $113 million that the governor wants to carve out of the $1.1 billion money? By the way, it's very hard for people to figure out what the pools of money are when it comes to the COVID and state budget, and we've never been more flush And I never expected in my career that we'd be in a situation where we're talking about too many pots of money to choose from and how to actually execute it. It's kind of crazy, isn't it?
I mean, I guess you could make the argument that it's a good problem to have. I mean, we have a surplus. We had CARES Act money. We now have $1.1 billion of ARPA money that we're going to be able to delegate through. There's a lot of opportunity there. And I'm a believer that I'm not one of the people that think that we need to rush to spend that $1.1 billion. I think it has to be very strategic. I think we need to really welcome public input. I think we need to fully vet every proposal and make sure that money is being efficiently spent. But in the meantime, when we have an issue like this, that is a crisis level and it needs money allocated to it immediately.
Well, I'm told there might be some adjustments in Medicare and Medicaid formulas that the administration and the leadership may find here over the course of early 2022. But it seems to me that while the issue is urgent, the solution has got to be multifaceted. And I don't know that pulling more than what the governor has allocated here in the $5 million to perhaps make some nonprofits or the state bureaucracy flush, I don't know that you're going to get what you need in the next 6 weeks, is my point. Right? You got to do this correctly. You got to be able to say, look, here's the new system for how we compensate these kinds of people, and this is how we're going to adjust. If we just keep throwing, $5 million here and $7 million there, I don't think that we skin the cat.
I agree. And I wrote an op-ed that was published in the Boston Globe yesterday. And I mean, admittedly, I'm somebody who will admit that throwing money at an issue is not always the correct solution to it, right? But I think it's safe to assume that inevitably we are going to appropriate more funding to this issue specifically. And if we know we're going to be there, why wait?
Right. Well, listen, I think the overall theme is correct, and all one has to do is spend a little bit of time in this community, either with the kids who need the help or the people who are trying to provide it, to understand the frustrations that exist. Stay on it because it's an important conversation. Appreciate it. All right, final word when we come back. Stay with us. Again, we have never had a situation in this state, or perhaps even in this country, where we have piles of money and we don't necessarily know exactly what to do with it or how to do with it what you want to do based on what the intent happens to be. This legislature is going to have its most important session in history, and I don't, everybody always says that, but it really is going to be. Not because we have huge deficits, but because we've got too much money. Crazy. See ya.